Breastfeeding is the healthiest start for all babies. Babies that are not breastfed have more acute, chronic, minor, and major health problems than babies that are breastfed. We see all kinds of benefits for newborns who are breastfed, especially if they're fed for 6 months to a year with their mother's milk. Some of the benefits would include lower risk of ear infections, lower respiratory infections, lower risk of hospitalization, and even lower risk of chronic diseases like inflammatory disease, cancer, obesity, and diabetes. What a lot of people forget too is that breastfeeding is also very beneficial for a mom. Right after she gives birth, that bonding time with the baby is going to help lower her risk of postpartum depression. It also lowers the risk of postpartum hemorrhage, and in the long term, it lowers risk of osteoporosis, breast cancer, and uterine cancer. One great fact every woman should know is that you actually give the baby about 500 calories a day just by making milk for him or her. So it's much quicker to return to your pre-pregnancy weight when you breastfeed than when you don't. Child care providers are a critical piece in breastfeeding support for mothers once they leave the hospital. Many mothers in our country go back to work really after just a few weeks of maternity leave. A mother needs to have full confidence that a child care provider will be able to handle properly the milk that she provides to feed her baby. Child care providers need to know how to handle, store, and prepare breast milk properly, and they need to have really good communication with mothers about how much baby's fed, what their challenges are during the day, and really what they can do to help support a mom in her efforts to continue breastfeeding. Child care providers should also be encouraging and should really help moms celebrate her commitment to the baby and providing that milk for a longer period of time than just on her maternity leave. The other important thing for child care providers to do is to really think about what policies need to be in place for their facility. What happens if a baby is fed the wrong breast milk? Mothers can be very anxious about when mistakes happen, so policies should definitely be in place to help support all breastfeeding moms and babies in the facility. I would recommend that any woman who's planning to have a baby first talk with her obstetrician about breastfeeding. It's important to read about it before giving birth to understand what challenges and what questions really need to be answered before the baby is born. In the hospital, it's important to ask for help from the nursing staff and from the pediatricians and family doctors who work there. We want everybody to walk out the door with the confidence, the knowledge, the skills, and the attitude to be successful in breastfeeding for 6 months, a year, or as long as is desired by the mom. Once leaving the hospital, there are a number of community resources that mothers can access. Everything from breastfeeding support groups to La Leche League to daycare resources and the health department. Many organizations have ways to support breastfeeding mothers. It's important for businesses too to have a critical eye to really look at the environment that they're providing for their customers to make sure that they have space that's appropriate for breastfeeding moms and babies.
The South Carolina Program for Infant and Toddler Care and your Early Education Program want the best for you and your baby starting today. Breastfeeding is the best feeding method because it provides optimal nutrition for your baby. It protects your baby's health and aids you, the mother, in your recovery from pregnancy. The proven health benefits to your baby are endless and include a lower risk of asthma, allergies, obesity, and diabetes. Breastfed babies also face fewer incidents of childhood cancer, infections, and hospitalizations, and are typically healthier overall than non-breastfed babies. The collective power of breastfeeding lies in breast milk itself, a natural food made by you for your baby. Breast milk has no preservatives, additives, expiration dates, or recalls, and is easier to digest than formula, leading to less spitting and gas pain for your baby. And for the mother, breastfeeding helps to effect weight loss and combat postpartum depression. Remember, breastfeed right after delivery and often. For more information on breastfeeding and its benefits, visit scpitc.org or talk to your obstetrician and pediatrician.